I have 6 minutes from the time you start. My name is Gale Morris. This is my audience, and I'm going to be talking about nursing. Have you ever wanted to work all day in scrubs, aka pajamas? Then maybe you should become a nurse. Have you ever walked around and seen someone hurting or choking and wanted to help them but didn't know how? Then maybe you should become a nurse. I'm a registered nurse. I graduated in 2006, and I want to explain to you the importance of nursing and how our lives can change other lives in the process. I also would like to give you the facts about nursing, who could become a nurse, how to become a nurse, and why you would want to become a nurse, and then the ministry that God can use through you as a nurse. So first, who could become a nurse? Well, anyone that's graduated or has an equivalent GED, and then there are just a few personality qualities that would be important. Number one, being patient and compassionate, and also to have organizational skills, because you're going to be dealing with a lot of patients and giving medications, and you want to make sure you give the right thing to the right person. Next, how would you become a nurse? Most nursing programs require prerequisites. Because it's dealing in science, you would need to do anatomy and physiology, microbiology, and then from there you can go to a community college and obtain your ADN, which is the Advanced Diploma in Nursing, or you could go to a four-year college and get your BSN, which is a Bachelor's in Science in Nursing, and that deals more in leadership and communication skills. Or you could do like I'm doing, the option of starting out as an ADN, then going back to school once you're working and your employer helps pay for the education. Then after you get your degree, then you have to pass the nursing board exam. It's called an NCLEX. And after you do that, you need to get state licensure for the state that you're going to be practicing in. And after that, then you will go to the next point of why you would want to become a nurse. And of course, money speaks volumes, so salary is probably the number one thing. And the nursing median annual salary is $31 an hour, and that would be about $65,000 a year. There's also lots of job opportunities. They are anticipating 22% in nursing jobs by the year 2018. The median age for a nurse right now is 46 years old, so half of the nursing staff throughout the United States will be retiring, so there'll be lots of growth there. Then there are options as to where you can work. You could be a school nurse, you could work in home health, you could work in a hospital, or you could do a doctor's office. There's lots of options. Then there's also shifts. You could do a 4-hour shift, 8-hour shift, 12-hour shift. There's nights, there's weekends, just whatever fits into your family schedule. There's also full-time, part-time, and then wage people that don't get benefits, but they just work when they are needed. Then there's also chance for advancement and career growth as you're a nurse. And so you would start out as a clinician and then grow, if you're in a hospital, in that hospital setting, based on your years of knowledge and experience, you can advance from a Clen 1 all the way up to a clinician 4 and increase your salary with that. Then you can also go back to school and get your APN, which is your advanced practical nurse, and deal more in management. Then there's certification also in your specialty. Next would be how nursing could be a ministry that God could use. First off, I would say compassion. In our textbook, there was a doctor, a neonatologist, and he was talking how he used his ministry to help the babies that were 22 to 26 weeks old when they were born. And a lot of the doctors felt like they were already imperfect, didn't have a chance of surviving. And he stated that any life had tremendous value, no matter how imperfect and no matter how long they lived. So before he goes to talk with the parents, he always prays and asks God to guide him into doing what the right decision for that child is. Hospitality would be the second thing that I think is important. In Matthew 25:35, Jesus said, "When I was hungry, you fed me. When I was thirsty, you gave me drink." And in the hospital, our patients are in unfamiliar territory. And so we take care of them by making sure they have what they need, linens and food and drink and all the basics that we can provide. So in conclusion, I hope that you see that nursing is an important aspect And hopefully in your lives you won't end up in a doctor's office because of illness or in an emergency room because of an accident. But if you do, just know that the nursing career is a valuable career choice for anyone, and that it can be obtained as long as you have the desire and the drive. I want to thank you all for being such an attentive audience, and also for being supportive while I was going through my nursing career. And I pray that God will richly bless all of you as you go on your way in making your career choices.